Hi, my name is Jo Chapple and I am here with Eithne Fitzpatrick. We are both chartered physiotherapists, and today we are going to talk to you about pelvic girdle pain and low back pain during pregnancy. So I suppose we'll start at the top, Eithne, and start by discussing what actually is pelvic girdle pain. I have my little helpful assistant.
Very good. Yeah.
Any use to anybody at all. So the white is obviously the bones of our pelvis, okay, and this model is just showing you how we have these two joints at the back here, sacroiliac joints, and then we have your pubic symphysis, there we go, the pubic symphysis joint at the front. And really, low back or pelvic girdle pain, pregnancy-related low back and pelvic girdle pain can really be pain and discomfort anywhere in this pelvic ring area and lower back section, can't it? So whether that's groin, pubic symphysis at the back or into the lower back, really and truthfully, we're just talking about pain in those areas, aren't we, from pregnancy?
Yeah, yeah.
And it's incredibly common, but that doesn't mean that every single woman will experience it. There are tons of different factors as to why a woman might develop low pregnancy and related low back and pelvic girdle pain. Would you agree?
Yeah.
Let's start the ball rolling on what some of those factors might be. Do you want to?
I think the first thing, just relaxin, I think gets a lot of blame for pelvic girdle pain. So relaxin is a hormone. Yeah, relaxin is a hormone that causes like increased kind of laxity in joints, and it actually peaks very early on in pregnancy between week 12 and 16, and it's been shown actually that it doesn't actually correlate. So levels of relaxin don't correlate with pelvic girdle pain, even though a lot of people get told, oh, it's relaxin, it's causing your joints to separate and get looser and a bit more unstable, but we're going to get onto that later. More likely what is contributing to pelvic girdle pain in pregnancy is like the most obvious one is really weight changes. So I mean, obviously you've got the growing fetus inside in the tummy and the breasts are getting bigger, so the pelvis is holding a lot more weight than it was before you were pregnant. And also, like, tissues have been found to become more sensitive in pregnancy, and this is seen to be likely to, like, estrogen changes actually, so kind of hormonal changes in the body causes some tissues to become more sensitive. But as well as that,
what do you mean by sensitive? Just to
like sensitive to load, I suppose, you know, like normally maybe bending, lifting, stairs, going up and down, like normal activities wouldn't be difficult. Like sensitive, really, like that's really what I would understand by it, you know. Like I suppose like pain is so complex, like we're not going to get into the whole understanding pain, but it's very much like a message from the tissues going up into the brain, and then it's the brain's interpretation of whether or not this is dangerous as to whether or not we feel pain, really. So sensitivity just means that maybe the levels of the messages that are going up into the brain, there's a little bit more intensity there than normal, so there's more interpretation of you know.
And I suppose as well, because pain is actually quite subjective, there's lots and lots of different things that will contribute to why a pregnant woman might get pelvic girdle pain or low back pain during pregnancy. And some of the other factors might be things like maternal age. It might be the number of pregnancies that she's had. You know, a woman who is on her first pregnancy, the princess pregnancy, where you can take your time a little bit more, compared to a woman who may already have 2 or 3 children. It's going to be a very different experience, lots more running around. Already got children. And other things like even whether or not the woman is constipated, those things can have an impact as well, can't they? And
definitely
hemorrhoids and things like that. And
how much sleep you're getting.
You
know, and also, like, you know, the other kind of stressors, like, you know, how, like, is work stressful?
Absolutely.
Job
satisfaction and
like all these kind of various factors can kind of drive up pain and make everything that bit more sensitive.
Absolutely, absolutely.
Mm.
I think for me, one really important message whenever I'm dealing with pregnant women with low back or pelvic girdle pain is the first message is, let's not worry, let's not freak out. I think there's an awful lot of scaremongering and there's a lot of fear around it, isn't it? Particularly if you're dealing with a woman who might only be 18, 19 weeks pregnant. You know, there's that look in their eyes as if to say, have I got this for the next 20 weeks?
Yeah.
You know, not necessarily, no. This might just be a little blip. This might be just growth spurt from baby. There's tons of things that can be done here.
Yeah.
I think we must acknowledge that some women's experience of pelvic girdle pain can be completely off the charts, can't it? There are some women who do end up with crutches and who are in significant pain, but it's my clinical experience, and I think the research shows it as well, that they are far and few between, thank goodness. You know, there are some women who do have quite horrific experiences with pelvic girdle pain, but the norm and the general experience is something far more manageable and transient, actually, isn't it? It can go relatively quickly. It's not something that has to persist. And there's
there's so much can be done about it, I suppose, as well. Like taking control, like understanding it more, rather than just kind of sitting back and just thinking, okay, this is something that's happened to me that I can't do anything about for my pregnancy.
Absolutely.
I mean, it's no wonder that drives up fear and, you know, fear of labor, fear of like, am I going to be able to cope with the labor, and then with having a baby on top of everything.
Yeah. I think lots of other things to say, that there's an awful lot of women who, if they get pain, pelvic girdle pain towards the end of their pregnancy as well, significant percentage of women will have spontaneous resolution of their pain postnatally as well, won't they? I mean, for some women it might last for several weeks, a couple of months, but you know, there is a sort of self-limiting sort of nature to this as well, isn't there?
Yeah.
But even if you are 18 weeks pregnant and starting to get pain, there's quite a lot that can be done, isn't there?
Yeah.
I think one other myth that probably bothers the pair of us as physiotherapists working with pregnant women is this notion that it's related to your pelvis going in and out of alignment. What would you have to say about that?
Yeah, I mean, I think I hear it a lot. I hear it a lot from patients. And I know that it's something people are told, you know, that your pelvis has gone out. And I think, like, the problem with a message like that is that it's massively fearful, because it implies that your pelvis is something that's vulnerable. That's like, if it's really easy to put your pelvis out, it just shows you how much you're gonna, you know, your body is gonna do everything it can to protect itself. What is actually happening more than likely is muscles are getting tighter on one side, and that kind of shifts the pelvis a little bit, maybe up or down or forwards or backwards. And that's a kind of an apparent kind of, you know, alignment issue. But the idea that your pelvis is, let's say, in or out of alignment or is unstable, inherently unstable, is not true. That actually the pelvis is the most like stable, strong, resilient joint actually in our body. Like, it's designed for weight bearing. And then unless you experience like a sudden traumatic road traffic accident, which, you know, breaks the bones and damages the actual pelvic structure, like we have, you know, the pelvis is surrounded by these really strong ligaments. It's not designed to move, like, and the amount of movement that's there is actually only minimal. So the problem isn't actually the movement, it's more actually to do with the sensitivity and how we are moving with the pain, you know.
So I mean, loads there actually. I mean, we can get really quite geeky and talk about the biomechanics of the pelvis and the joints, and talk about how they're designed or evolved to be, you know, one of the most strongest or sturdy, robust and resilient parts of our body. Really very well designed, really beautifully structured. And, you know, as you said, the movement that is possible there, even in the presence of the pregnancy hormones, it's negligible, it's minimal, isn't it? I mean, you'll have the movement capacity for actually giving birth vaginally. Obviously, we need that. But, you know, to sort of have this notion that your pelvis is so unstable that it can go in and out at any time is really, it's not factually correct, and it really
No.
fear inducing, isn't it? And
it's a negative message, isn't it?
And some of the sort of things that then spiral on from that, you know, a lot of the hands-on treatment is to put your pelvis back into position. Well, if we look at sort of a lot of the effective things that can be done, what is it that is effective? Is it the actual hands-on sort of calming down, sort of that feedback, that soft tissue release that's giving us the benefit, as opposed to actually putting a structure back into place? Because like you say, something that is inherently so strong and so solidly built, it's really only going to take a high velocity force or impact, like something like a car accident, for it to actually really significantly be out of place, you know.
Absolutely, yeah. And I think it is all about then, like, looking at what does help, like what does calm everything down.
Yeah, and there's loads of things. So what sort of things would you sort of suggest?
Well, I mean, you mentioned a few there, like massage and that, and I really think like that can help, like, and it can be something you can do yourself, or your partner can do to you, or, you know, there's lots of different kind of things like that that can help. I think heat is very helpful for some people. Ice packs for others. Yeah, absolutely. Like, you know, different, you know, each person's going to have their kind of individual things that help and that don't help. I think like positions of ease, like, you know, really looking at what feels good for your body, what positions feel good, what postures feel good, and then what movements feel good.
Yeah, absolutely.
Because actually, you know, a lot of it, if we consider it as a pelvis that's, let's say, having to bear more load now than it's ever had before, you know, so much of it is about that maybe the muscles around the pelvis aren't as strong as they used to be.
Yeah.
So, you know, you have to think about, let's say, your glute max and your glute med in the buttock muscles, and your abdominals having their big massive stretch, which is weakening them. So how can we kind of get on board with doing movements that feel good for your pelvis and low back, but then equally looking to maybe strengthen the muscles that do support the pelvis?
So you're suggesting that actually, or, you know, is it safe to do exercise when you've got pelvic girdle pain?
Absolutely. I think it's what you choose to do is the question there, as opposed to whether or not it's safe, you know. But I think, again, it's so important for people to understand that their pelvis, they're not going to do damage by exercising, you know.
Yeah, and I think it's all about context, isn't it? If we're talking to somebody who, I spoke recently to somebody who is a triathlete, is running all the time, and she's halfway through her pregnancy, and, you know, she started to develop some aches and pains, and she's wondering, should she stop everything? And, you know, I think we need to be very careful with generalizations, because there are no sort of specific formulas. There's no sort of specific do's and don'ts. There's sort of guidelines and suggestions and modifications for the individual.
Yeah.
So this particular person, this particular lady I'm thinking of, by her just changing some of the variables, by looking at her sort of pace, her distance, her time with her runs, her stride length, and just playing around with a few of these bits and pieces, she was able to bring her pain right down under control, and now she's able to carry on with her running. And she's still doing sort of static bike, not swimming at the minute with pools closed, but, you know, it's about trying to just look at things objectively and what is appropriate and effective for the person, for the woman in front of us, and not just having this blanket approach of pain, therefore you must stop. Like you said, you know, the physiological changes that happen in our bodies when we're pregnant, it's massive, it's profound, and the mechanical change is huge, and, you know, the length tension ratio on the muscles and all of this. And if we can maintain certain levels of exercise, activity, and physical strength and fitness, you know, it is more than likely going to pay dividends for the woman, for her pregnancy, and thereafter into the postnatal period. But are all exercises right for each woman? No, it's about time, isn't it? And tailoring to a woman.
And I mean, it has to feel good for their bodies, you know, like, you know, again, what suits one isn't going to suit another.
Absolutely.
You know, and if something doesn't feel right, I think it is about kind of respecting that, you know, listening to your body there, and looking then to modify it or do it in a different way.
Yeah, completely.
You know?
Yeah, absolutely. And so, you know, what sort of exercise you do is going to be very unique, but, you know, physios can give you some guidance and help you sort of come up with game plans and exercise programs throughout your pregnancy. It isn't that you've got to find your own answers. That's not what this is. But then, like that, I think the same is true with a lot of the other recommendations that are made about managing your pain during your pregnancy, because often, I mean, I know I'm speaking about myself, but once upon a time, I would have spoken to a pregnant woman with pelvic girdle pain in quite fearful terms, saying, you must not cross your legs when you sit. You must not have the legs too wide apart. So you've got to be very careful with how you get in and out of the bed, and you really must not do these things. And, you know, those kind of suggestions, they're not very helpful, because you will meet some women who can sit with their legs, and that is not the trigger for their pelvic girdle pain. You will find some women who may find getting out of the car is the problem, but not necessarily getting out of bed. So we have to be much more individualised with our information. Appreciating that there may be similarities. It might be
absolutely,
legs too wide may be uncomfortable. It might be that running up the stairs, literally taking 2 steps at a time, is probably too much when you've just had a growth spurt with your baby in utero, and sleeping well for whatever reason. So it might be that, you know, at that point, if you are getting pain, rather than running up the stairs 2 steps at a time, just go 1 step at a time. Or put your foot up onto one step, follow with the other. Foot onto the next step, follow with your other. And, you know, there can be formulas about which leg you should lead up the stairs with, which leg you should lead going downstairs. Again, I'm less specific with that now as well. I think what is comfortable for the woman, what works for that individual woman. It will be different, given everybody's different abilities and physical fitness and well-being and so on.
Absolutely, And I think also to say on that note is, like, if you're carrying a toddler on one hip, there's like for some people kind of asymmetry can drive up pain and pelvic pain, and then not for others. So, I mean, it's a factor. It can be a factor for some that if the tendency is to hold the child all the time on the left hand and then operate everything, right hand is doing absolutely everything else, that there are changes in load at your pelvis there, and it may be a good idea, rather than, you know, wondering why one side is always giving out, in changing it up. Maybe holding the toddler to the opposite side, or in front, or wherever.
Absolutely. And I think sort of having the confidence to sensibly reason that out. You know, there's nothing dangerous about carrying your toddler on your hip. Nothing harmful about it at all. But like you say, if our structures are that little bit more sensitized, if there's been a significant growth spurt, if you're feeling particularly tired, if you're a bit stressed out, all of these different things, you know, it might be that actually, instead of carrying the toddler all on that one side, swap it over, you know, and just making those changes. What's your opinions on belts and supports and all of these things that we sometimes...
I think they can help people. I don't think they're the answer. I think some people like to think, oh, a belt will sort out everything, will sort out my pain. You know, it's not the answer, but it can help some people. I think it's one of these that, I mean, literally, if you try it on and it feels amazing, like it makes a massive difference, I would say go for it. But if, like, for some it doesn't do anything to their pain, and if anything, some it makes their pain worse. And it's only going to be good when you're weight bearing. It's only really for when you're upright, you're standing, you're walking. It has to be kind of loosened or taken off when you're sitting, you know.
And we're talking about having it around the pelvic bone, so it's under.
It has to be low enough, it's
not on your tummy, it's not on, but you've got other things like the tuba grip that you can wear that comes up and above bum. So again, like that, I find that some women it works and absolutely they work a treat for, and sometimes they don't. And it's not that that's wrong, and it's not that it's right, and it doesn't mean one thing or another, and it doesn't mean that your pain is therefore worse or you're going to be experiencing more pain. It's, you know, they're all very unhelpful sort of beliefs, I think, aren't they? And sometimes they help people and sometimes they don't. And there's tricks that we as physios can do to see if somebody might find a bit more relief from a belt. But I think very much at the end of the day, if a woman is saying to me, it's amazing, that's good enough for me. But if a woman says, I really don't like it, I am not going to make her where, you know, that's not the way to go anyway, is it? You know?
Yeah, absolutely, yeah.
Their sort of feedback and opinions. Okay, so lots that can be done, gentle exercise or even more cardio exercise if the woman is familiar with it, or modifying things accordingly, playing around with the pace, the duration, the intensity, weight load, finding positions of support, so using things like pillows and cushions, taking the time to have a bit of downtime as well sometimes, stretches, massage, gentle heat, ice, getting sleep, eating well. Sometimes if things like constipation is a bit of an issue, then sort of making sure that the diet is really good as well, because, you know, lots of hormone, iron supplements during pregnancy can also slow motility down a little bit in the bowel, so that might be feeding into things a little bit there. And not to sort of be too concerned that there is anything necessarily out of place. And not to be too worried that this is something that is going to stay with you for the rest of your pregnancy. There's a lot that can be done, and it might just be literally some, you know, something very transient. And there's a lot of sort of modifications and things that you can do during your day-to-day that might help to reduce that pain and discomfort. And
definitely.
For a lot of women, it doesn't have to stay.
And, you know, let's say even having, you know, sometimes part of the problem is that, you know, the day might be already quite full between, let's say, getting up, going to work, sitting down all day at work, and then coming home and kind of being busy in the evenings. And almost like, you know, it can be, for some people, that they're very sedentary, actually, that they're driving to work, they're sitting all day at work, and that they're not moving around enough, you know, that all this load, again, you know, in sitting, it's all kind of like resting on their pelvic joints and their low back and sitting. So it's more about kind of like, can you move a little bit more in your chair? Can you get up and walk around? Changing it up, really, you know.
And how concerned would you be about posture with those women?
I think the idea that there is a right posture.
The right posture and the ideal posture and all of that, because you hear that a lot as well, don't you? I
would hear that a lot. And I suppose my problem with that is that if we think there's a right posture, we gotta get it in our heads. A lot of what we see when we ask someone to do, let's say, the perfect posture, is that they sit up nice and tall and they're engaging all the kind of various muscles, really stiff and rigid and holding on. The reality is that every posture is a right posture, really. It's all very individual. Like if someone is slouched all the time and they say, my problem is sitting, I would say, well, what about trying to sit a little bit differently and see how that feels?
Absolutely. Variability.
It's not about right and wrong.
Absolutely. Give your body a bit of a break, spread the load, without any tightness and stiffness, and trying to just mix it around a little bit. Like we said, with the toddler on the hip all the time, mix it around a little bit. So not to get fixated on the perfect posture, but perhaps just introduce a bit more variation and variability in the posture. And I think that made me think of one other thing, and we'll wrap it up soon then, is that sometimes some women might be getting pain because they're just exhausted and they're just doing too much, still trying to hold down the full-time job, still trying to juggle the kids as well if they've already got them, or whatever else may be going on, and, you know, constantly on the go, up really early, fitting loads of things into their free time, and just busy. And sometimes, not always, but sometimes it might be that the pain that they may be experiencing may just be a bit functional, and it's just literally a case of just calm down a bit, or just take your foot off the gas a little bit, or just, instead of being in fifth gear all the time, come down to gear 3 and just see how that is for you. You won't necessarily have to stop anything or change too many things, but maybe you're just perhaps doing a bit too much, and maybe you just need a little bit of time just to sort of breathe, you know.
And I've seen that help a huge amount of people, actually, when they do that. And when they give themselves that permission to just slow down a little bit. I mean, it can make massive differences to their pain.
Yeah.
When they can allow themselves that.
Yeah. And it's not about that they're doing anything wrong. You're not causing any harm. Often body a little bit of time. Just give it a little bit at a time. Let it catch up, because, you know, ultimately you're growing a human. That's pretty massive. The energy that takes, everything that's required to do that, you know. So there's loads that can be done. Pelvic girdle pain does not need to be a sentence for your pregnancy. It does not need to be the end of everything that you love and enjoy, but lots of modification, lots of variation. And if people have got questions, then physios, pelvic health physios are well equipped to help sort of deal with it. You know, we can answer any questions that people have as well. But any final thoughts on that, Eithne?
I think everything you said, you kind of summed it up well, Jo. Just to remember really that our pelvis is resilient, is strong, and is extremely robust, you know, and is well able to transfer load in our bodies, you know, so we don't need to be afraid. It's understanding that it's about that the pelvis can get sensitive, it can get a little bit traumatized, and if we calm things down and look after it, look after ourselves, and then look to just get things back up again once we feel comfortable moving and doing a little bit more exercise. Yeah.
All good, all very sensible and all good. Thank you so much for your time, Eithne, and if this has been helpful, people let us know. Yeah, it's good to get the information out there. So thanks for your time, Eithne, really appreciate that. Take care, bye-bye.
Bye.